Hello and welcome back to the Gluten-Free RN podcast. I'm Nadine Groskowiak, RN, BSN, CEN, and the Gluten-Free RN. Today, during episode 38, we're going to tackle a really difficult topic. We're going to talk about celiac disease, suicide, and associated morbidity and mortality. And of course, morbidity and mortality are sickness and death. Stay tuned for lots of good information. Hello and welcome back to episode 38 of the Gluten-Free RN podcast. Welcome to everyone and thank you for listening. I really appreciate everyone that has listened worldwide, and especially to those of you that have left a rating and review on iTunes or wherever you listen to the Gluten-Free RN podcast. Your comments and feedback really help me determine which topics to cover and the information to give to you, and whether I'm doing a good job or not. Very important information. So today, during episode 38, I would like to dedicate this topic to my nephew, Ian, whose birthday it is today, August 13th. He was born in 1987. Very tragically, he died February 19th in 2007. He didn't quite make it to 20 years old. And for those of you that have known me for a long time, you know that I was diagnosed with celiac disease by accident in October 2006. As I was launching my first business, RN On Call, I got a phone call while I was working in the emergency department that my nephew had died. I tell that story in my book, Donation, D-O-U-G-H, Nation, a nurse's memoir of celiac disease from misdiagnosis to food and health activism. And I tell his story because it's tragic every time that someone dies, and it's also tragic, perhaps even more so, when they die not knowing they had celiac disease. I'm doing this episode in honor of my nephew, who would be 30 years old today. He, like many of my other relatives, have addiction issues or had addiction issues. We have extremely strong family genetics, which predispose us for celiac disease. But unfortunately, I will never be able to confirm that Ian actually had celiac disease, although my suspicions run very, very high. So in honor of Ian, today during episode 38, we're going to tackle celiac disease, suicide, and associated morbidity and mortality. When I first started the Gluten-Free RN way back in February, March of 2007, I had already done a lot of research on celiac disease and non-celiac gluten sensitivity, or gluten intolerance as it was called at that time. And I came across an obituary in the paper for a very actually young gentleman who wanted it known that he died of celiac disease. And I thought that was a great tribute to him, and also as a reminder and as an education piece to remind people that celiac disease can and will kill people if it is not taken seriously, and sometimes even if it is taken seriously. Morbidity and mortality are two terms that mean sickness and death. We already know that people with undiagnosed celiac disease have an increased risk for morbidity, which is sickness. And how does that show up? It shows up in many different ways. Chronic anemia, fatigue, osteoporosis, failure to thrive or failure to grow, infertility, thyroid issues, any associated autoimmune disease such as type 1 diabetes, lupus, MS, Sjogren's, and the list goes on. Celiac disease is actually highly represented in the populations with Down's, Turner's, and Williams syndrome, and I would refer you back to that episode. The WHO, which is the World Health Organization, notes that diarrheal diseases are the number one killer of children. However, WHO, which is the World Health Organization, has only funded one study on celiac disease. And what they found is that celiac disease is at a super high rate in pediatric patients of Swahili descent in North Africa, actually at a rate of 1 in 19 children. And that's only using the tissue transglutaminase marker as part of the celiac panel. So let's tackle suicide first. Let's tackle the fact that depression, anxiety, antisocial behavior, mental health disorders, and all other types of symptoms are associated with celiac disease, undiagnosed celiac disease especially. I have given 8-hour lectures on the mental health components associated with celiac disease over the years because mental health disorders are very prominent in undiagnosed celiac disease. It is very important to recognize that a person's brain is affected by gluten, and the removal of the gluten can potentially reverse or alleviate many of the mental health type symptoms that show up in undiagnosed celiac disease. I myself was irritable, cranky, depressed, had some anxiety, and my kids will tell you I was irritable and cranky. I can tell you that once I went gluten-free and the brain fog went away, I got my brain back. I made major life decisions and changes. I decided to be a happy person and to really embrace all life had to offer. I didn't look at celiac disease or changing my diet as tremendously depressing. Actually, it was very freeing. Once I knew what was causing all of the signs and symptoms that I'd had since childhood, and they started to go away, trust me, I got a lot happier. There was a period of time when I did grieve having to give up all of my gluten-laden foods, which I had grown up with, but I quickly got over that. And I even determined that there was no way in heck I would ever go back to intentionally eating gluten. Even if I only had a few weeks or months left to live, I would never do it. It's not worth the pain and suffering that gluten causes. And gluten does cause a fair amount of pain and suffering. Gluten being the long-chain amino acid protein in wheat, barley, and rye, and also sometimes oats because of cross-contamination. I started out on a gluten-free, dairy-free diet and quickly switched to a paleo diet, which is essentially a whole food diet focusing on meat, fish, eggs, fruits and vegetables, nuts, and seeds. Despite having almost been dead when I was 40, I am now 51, and I am much healthier now than I've ever been in my entire life. I had the opportunity to die when I was 40 of multisystem organ failure, and I had 7 autoimmune diseases that I don't have anymore, and I'm very lucky. I'm extremely lucky that a dermatologist actually recognized that I had dermatitis herpetiformis and celiac disease. And the interesting thing is that all my tests were negative at that point. My celiac antibody test was negative. I'm not IgA deficient, or I wasn't at that point. My skin biopsy for dermatitis herpetiformis was also negative. Looking back on it, the biopsy was taken incorrectly. Come to find out, I'm an HLA-DQ2.5 homozygous gene carrier for celiac disease, which puts me in the super celiac category, or you might as well pretty much plan on having celiac disease at some point in your life. I'm pretty much guaranteed to have celiac disease because I got genes from each parent. And that would have been a great thing for my parents to know. So I am encouraging everyone, at the very least, to find out if you're a HLA-DQ2 and or DQ8 gene carrier. It's a simple test. It's a cheek swab. And you can already be on a gluten-free diet to get that gene test done. Any doctor can order it. It's not hard to interpret, but if there's any questions, please give me a call or find a practitioner that actually knows how to interpret those genetic results. For those of you that have already looked at the podcast notes, you'll notice that I've already put in a number of resources on morbidity and mortality, suicide, and celiac disease. The reality is there's many, many more resources, and I encourage you to do as much research on your own as possible. Because even with a diagnosis, we are much more likely to die early or have increased morbidity and mortality, despite being even on a gluten-free diet. That's one reason I adopted, as soon as I knew, a paleo-type diet or a whole food diet, focusing on local, fresh, 100% organic, 100% gluten-free food. Because food is my medicine. Food is your medicine, whether you know it or not, because food can help us stave off all types of morbidity and mortality. I've also included a study that shows that people that have AFib are much more likely to have celiac disease. And if you have celiac disease that is causing your AFib, and much more likely a magnesium deficiency, then if you correct that magnesium deficiency by going on a gluten-free diet at the very least, or hopefully some form of a whole food diet, there's a good chance that AFib will go away, even without medication or pharmaceuticals. And of course, we know that AFib increases your risk of stroke and sudden death. So of course, we want to avoid those things if at all possible. So find out if your AFib is caused by celiac disease and possibly a magnesium deficiency. And of course, as I've mentioned before, we always want to make sure that that magnesium is an RBC, not a serum level. So find out how much magnesium is in your red blood cells. That's very important. There's also many studies that are done with people that have been diagnosed with dermatitis herpetiformis, and we know that their suicide rate is increased, especially the people that don't know they have dermatitis herpetiformis and that there's hope for them. People that have dermatitis herpetiformis have extremely painfully itchy skin for the most part. That's part of having dermatitis herpetiformis. It's not contagious. Nobody else can get it. Dermatitis herpetiformis is a rash that is actually an external expression of what's going on inside, typically the intestines, maybe the other organs, but not always. Sometimes the dermatitis herpetiformis is the only manifestation of undiagnosed celiac disease. And honestly, the only thing that will help it is being on a 100% gluten-free diet. In the past, I've heard of people being prescribed Dapsone, which is an old school antibiotic, and it can help with dermatitis herpetiformis as long as that person is also on a gluten-free diet. If a person is only taking Dapsone for dermatitis herpetiformis and not changing their diet, that damage will still be going on in the rest of the body, increasing that person's risk of bowel cancer and lymphoma and potentially any other cancer. So it's very important that everybody with dermatitis herpetiformis know that they can't just be on Dapsone, and Dapsone can be very toxic to the liver. Any prescription for Dapsone should only be on a limited basis. It's not an antibiotic or a drug that people should be taking for weeks or months or years, which unfortunately I've heard of people doing. So it is a very limited time that you should be taking Dapsone for dermatitis herpetiformis. Since I mentioned malignancies, also known as cancer, it's important to know that it is primarily lymphoma. It's also noted that there's an increased risk of small intestinal adenocarcinoma, esophageal cancer, and oral pharyngeal cancer in diagnosed celiac disease patients. Of course, that risk goes up if they're undiagnosed. Most of the malignancies occurred in this particular study, which I've included in the podcast notes, shortly before or after celiac disease was detected. Now, I've had several people come into my office that had been diagnosed with different cancers, such as kidney cancer, neck cancer, salivary cancer, brain cancer, and then they found out they had celiac disease. So I would suggest that potentially every cancer is potentially preventable if you're on a gluten-free diet. So let's just consider avoiding gluten, especially if you're an HLA, DQ2, and or DQ8 gene carrier. Those of us that are predisposed for developing celiac disease, but we would have to be eating gluten to ever develop celiac disease. So if we don't eat gluten, we'll never develop celiac disease. And potentially it would be protective. Not eating gluten or not exposing ourselves to gluten would be preventative for so many other issues, including chronic anemia, osteoporosis, osteomalacia, thyroid disorders, dementia, Alzheimer's, MS, type 1 diabetes, and the list goes on. We've talked about a lot of these things in the past, and there's been a little bit of overlap, but it is very important to talk about the increased prevalence and mortality in undiagnosed celiac disease, because what we know is that people are suffering for at least on average of 9 to 15 years and not being diagnosed correctly. They're diagnosed with many different things and put on many different pharmaceutical medications that may or may not be helping them. And some of those medications may make them worse. We also know that children who are diagnosed with celiac disease in childhood have a threefold increased risk of death occurring primarily from suicide, accidents, and violence. Add that to the cancer and the cerebral vascular disease, such as stroke, even in childhood, that are causing these kids to die. And of course, as a nurse, I would like to prevent sickness and death in children and adults. And I hope all my nurse friends would agree that if we're really going to talk about prevention, we have to talk about diet, and we certainly have to talk about celiac disease. Also noted in my book is that I had a conversation with a medical examiner of the state of Oregon, and he was kind of a crotchety old guy. I did suggest that he get tested for celiac disease too, as I do for all of the healthcare providers and doctors, anybody that's a primary care provider. Of course, I recommend that everybody get tested for celiac disease, but he was particularly curmudgeon-like, so I suggested he get tested for celiac disease. The reason I called him up was because I wanted to find out if people could be diagnosed with celiac disease on autopsy after they'd already been dead. If, in fact, my state was actually testing people for celiac disease on autopsy. And he pretty much referred me back to a gastroenterologist, and I had to several times repeat myself that I was talking about dead people. People that had died in violent attacks or of suicide or sudden cardiac events, or people that, we just don't know why people die. So it would be great if on autopsy people were being tested for celiac disease. I've not been able to follow through with that yet to find out if the state medical examiner in Oregon is actually testing for celiac disease on autopsy, but my guess would be that they're not. However, I did find a great study, and again, it's included in the podcast notes. It's called Necropsy Studies on Adult Celiac. And interestingly enough, it is dated 1974 from the Journal of Clinical Pathology. So the idea of testing for celiac disease on autopsy is not new, and that question had been asked many times. And interestingly enough, I'm going to read the synopsis. The distribution of mucosal changes in adult celiac disease have been studied in 24 cases within 4 hours of death. There were 6 patients on a normal diet who showed flat mucosa in the jejunum, convolutions in the middle third, and digitate villi in the terminal ileum. A more extensive distribution of flat mucosa and convolutions involving most of the small intestines was noted in one case. 18 patients had been treated with a gluten-free diet, and 11 had responded well clinically and histologically. No evidence of flat mucosa was discovered at necropsy in 6 of these. Attention is drawn to the high incidence of malignancies in this series, 13 out of 24 cases. Other complications of adult celiac disease are discussed briefly. So here we have a study that was done in 1974 that actually showed, interestingly enough, that there was Villus atrophy even in the terminal ileum, which means at essentially the ileocecal valve, which is at the very end of the small intestine and the beginning of the colon. So when I talked to one of the gastroenterologists and I had said, why, when you do a colonoscopy, do you not test for celiac disease in the distal ileum? And I laugh about it, but he actually said, well, if it was an autoimmune disease, we would. Well, guess what? Celiac disease is an autoimmune disease. And yes, you can test in the distal ileum for Villus atrophy, even during a colonoscopy without even doing an endoscopy. The conclusion of that same study basically said, it is also clear that although a good clinical response to a gluten-free diet may be associated with a return to a normal villus architecture or grade 1 abnormality, which would be the MARSH1, the flat mucosal lesions persist to a lesser extent in a proportion of cases. This could be due to the persistence of small amounts of gluten in an otherwise gluten-free diet or to other unknown factors. Complications such as malignancy or ulcerations may be associated with failure to respond to a gluten-free diet or with relapse of symptoms, but it is of great interest that one of our patients with lymphoma gave an excellent response to a gluten-free diet. So even though symptomatically they had a great response to a gluten-free diet, they still ended up with lymphoma. And this is one very good reason why, as a celiac person or a person with celiac disease, I am not going to take for granted the fact that I am going to be healthy forever. I had undiagnosed celiac disease for 40 years. And despite my best efforts and being on a very strict gluten-free diet and a paleo diet, I still get hit with gluten way too frequently. One, because I don't want to live in a bubble. And two, because, honestly, I do my best, but I still get gluten every once in a while. So one very good reason for never cheating. And two, to be hyper vigilant about what you're eating, where, and who's preparing it. Because even one episode of getting hit with gluten can cause villus atrophy or a sequelae of medical symptoms that are very hard to recover from. And if you're constantly getting little hits of gluten, our bodies are going to have a harder time healing. So we do have to be vigilant. We do have to be 100% gluten-free, but it is worth it. I am much happier and love living and traveling and just overall have a general sense of well-being being on a gluten-free diet. Even though I've had some damage done that I can't reverse, I still try. I'm still my own experiment. And yes, I do experiment with my food. My food is medicine. And sometimes I take things out. Sometimes I try things like low FODMAPs diets and different things depending on the symptoms that are still present or that show up. And if I really am trying to clean up my system and give my liver a break and detox a little bit from just general environmental toxins, then I will do a limited fast, maybe for 3 days or for 7 days, and give my body a rest. Give my organs a rest. Give my immune system a rest. Since 70 to 90% of your immune systems are in our intestines, we really need to make sure that they're healthy. Even as a nurse in the emergency department, we really didn't pay too much attention to the intestines unless there was some really overwhelming symptoms associated with the intestines. For children, it would be intussusception or bowel obstructions or constipation, diarrhea, things that would bring people into the emergency department because of electrolyte imbalances or appendicitis or pick something. So we really didn't pay very much attention to the intestines unless it was overwhelmingly a intestinal type symptom or issue. But the reality is that the vast majority of signs and symptoms originate in the intestines. So it's very, very, very important that we all make sure that our intestines are in the utmost health and that the inflammation is gone and we are healing our immune systems. Because it is noted that homocysteine levels are typically higher in a newly diagnosed celiac patient. And we know homocysteine levels that are higher are related to all kinds of other health issues. So we really want to make sure that the homocysteine levels come down and that our body is not on fire with inflammation, and we give our bodies a break because our bodies are really good at compensating for a period of time. And generally, people will just get used to how our bodies feel. We'll take pills to alleviate symptoms or some type of cream for our skin to alleviate the itching. But at some point, all of those things will catch up with us if we don't deal with the underlying issue. And how does that happen? Well, it can be many different things. Some people will end up with myocardial infarctions or heart attacks or strokes, or they'll have to have their appendix out because it's inflamed. Unfortunately, a lot of people have their gallbladder out. These are all signs and symptoms. These are all red flags that our body is not in a state of homeostasis or health. Ideally, everybody will be healthy. And when I look around and I look at people, I can see the morbidity. I can see the sickness. I can see the people that are the most unhealthy. And then if you ask a couple questions, which nurses are really good at, especially those of us that have been in the triage booth and any emergency department, we can tell relatively quickly just by looking at people and asking a few very pointed questions how sick they are and how quickly we have to treat them. At this point, I'd like to mention refractory celiac disease. Refractory celiac disease is when people's intestines do not heal despite being on a gluten-free diet. Either they're continuing to get gluten or their body is past the point of healing, of being able to heal on a gluten-free diet. Many of these people are found to still be getting trace amounts of gluten, and that's why it matters so much as to paying attention to the cross-contamination risk, the shared living facilities, and whether, the whole family is gluten-free or just the person with celiac disease, whether your spouse is gluten-free if you're celiac, because you're going to continue to get exposed to gluten in all of those cases. So it's very important that your entire family go gluten-free or your entire house is gluten-free to minimize your risk, because the risk of continued sickness or continued symptoms and early death are extremely real possibilities. And we want to mitigate that risk. We want to make it as less as possible. We want to make sure that anybody that has celiac disease feels safe where they live, where they work, where they go to school, because it takes an emotional toll on people to always have to be super hyper vigilant and to be sometimes ridiculed or mocked or not feel safe, even around people that supposedly love us. So we want to make sure that these people are safe, that they have access to safe food and safe living environments. I will say that if you are in an abusive relationship and you're celiac, please try to extricate yourself from that relationship, whether it's through moving out or divorce or however you can make yourself safe, because you become enormously more vulnerable the minute you have celiac disease and you're in an abusive relationship. So find people that can help you and get out of that relationship. Because otherwise, these are the people that we find that will commit suicide, the people that don't have any hope, the people that are not getting better despite being on a gluten-free diet, that don't feel supported, that are still having depression and anxiety and mental health disorders that are not being addressed. Maybe they're not being believed that celiac disease is a real disease. That one gets me every time. It's not a fad. It's not going away. It's on the increase. So these people that are actually antisocial or mean, nasty, and cranky need to be tested for celiac disease also, because we know that celiac disease is primarily neurological, and we also know that if you have a leaky gut or increased permeability of your intestinal wall, you also have a leaky blood-brain barrier. leaky lungs, leaky skin, leaky blood vessels, and the list goes on. Anything that is epithelial tissue has the potential to being leaky also. Once you have a leaky blood-brain barrier, the gluten protein will cross the blood-brain barrier, and that's a long-chain amino acid. Even in the emergency department, we only had mannitol, which was a medication that we used for severely head-injured patients. It worked very much like Lasix or a water pill for the brain to decrease the intracranial pressure. That was the only medication that we had in the emergency department that would cross the blood-brain barrier. But here we have a situation where that long-chain amino acid protein, the gluten and the gliadin, will cross the blood-brain barrier and cause inflammation of the brain. Not only does it cause inflammation of the brain, but it also causes hypoxia. Hypoxia being decreased oxygen flow. Our brain needs a few things. It needs glucose and it needs sugar. And here we have a situation where your brain does not have access to enough oxygen. At the very low end, that can be the brain fog or the anxiety or the depression. Sometimes it adds to the fatigue. On the very higher end, it's the bipolar disease, the antisocial behavior, the learning disabilities, schizophrenia. So absolutely everyone needs to be tested for celiac disease to prevent these things from happening, and then they need to be supported on being on that gluten-free diet. And hopefully they have the option of being on a paleo diet, or as we now like to say, a whole food diet, which consists of 100% grass-fed beef, lamb, meat, so deer, elk, whatever you have available to you that does not have any antibiotics or hormones added or given to it. So grass-fed meat, no antibiotics, no hormones, eggs, fish, fruits and vegetables that are organic, because even in the absence of celiac disease, the glyphosates or the Roundup will cause a leaky gut. So even in the absence of celiac disease, if you're eating conventionally raised fruits and vegetables that have been sprayed with Roundup or glyphosate, then your risk of having a leaky gut increases. Even if you don't carry the HLA-DQ2 and or DQ8 gene, but you've been exposed to the glyphosate or the Roundup, there's a good chance you have leaky gut or increased permeability of your intestinal wall. And of course, the goal is always to remove the gluten, allow the villi to grow back, which takes about 6 months to a year, heal the inflammation, so we're removing anything that's pro-inflammatory, and then allowing our immune system to heal. After that 6 months to a year, we'll deal with any other signs or symptoms that come up. But those are your primary goals during that first 6 months to a year. And like I said, there may be other issues to deal with after that first year, but that's enough. If you can deal with that, if you can be on a 100% gluten-free, dairy-free, and or paleo or whole food diet, on a whole food diet, you will get better faster. And that's why I make sure that everybody knows they have that option and should be encouraged in that opportunity. As I'm wrapping up this episode 38 of the Gluten-Free RN podcast, I'd like to wish my nephew Ian a happy 30th birthday posthumously. I really wish he was around to enjoy his life and to potentially find out that if he changed his diet, life would be much better and easier. And I can only wish the same for everyone else in the world. Happy birthday, Ian. And this is the end of episode 38. A little bit morbid, but we had to do it. Celiac disease, suicide, and associated morbidity and mortality. If this information actually prevents one person from getting sick or dying or committing suicide, great. As a nurse, I'm more than happy to take on the tough topics that are not getting addressed or should get addressed more. Please find somebody that you can work with, a healthcare provider in your area, in your country, wherever you are, that can help you get better faster. Undiagnosed celiac disease kills people, and it makes them very, very sick. So you have the opportunity and the knowledge to recognize celiac disease and act appropriately. Thank you very much for joining me, Nadine Griskoyak, the Gluten-Free RN, for episode 38 of the Gluten-Free RN podcast. Happy living. Bye.